Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Schizophrenia, and you're looking at its symptoms. So the symptoms are divided into positive and negative. Now we look at the positive symptoms. The positive symptoms is the presence of hallucination. So you have hallucinations, then you will also have delusions. Next is the bizarre motor acts are also present. So you have bizarre motor acts. Next is, it is common in terms of the acute schizophrenia. So it is common. So it is common in terms of the acute schizophrenia. Acute schizophrenia. Next is, there is presence of hyperactivity, and this is the dopaminergic system in the mesolimbic system. So there is hyperactivity. The hyperactivity of the dopaminergic system. So hyperactivity of the dopaminergic system, and this is in the mesolimbic system. This is involving the mesolimbic system. Next is to respond to the most typical and atypical antipsychotics. So it responds to the most typical as well as atypical. So it responds to the most typical and the atypical antipsychotics. So this was about the positive symptoms. Next is we look at the negative symptoms. So negative symptoms, it includes there's flattening of effect. So negative symptoms, there's flattening of the effect. Next is there can be anhedonia. Anhedonia. There is also allogia. There is allogia. There is presence of apathy. There is paucity of thought. There is paucity, and this is nothing but of the thought. And there is poverty of speech. Poverty of speech. Next is the common in, it is common. So common in terms of the chronic schizophrenia. In terms of chronic schizophrenia. Next is there is hyperactivity of the dopaminergic systems. There is hypoactivity. So there is hyperactivity in the dopaminergic system. And this is in the mesocortical system. This is in the mesocortical system. And it responds better to the atypical psychotics. So the response, if you see, it is better. The response is better. And this is with antipsychotics. To learn and grow daily like this, please do subscribe.